Hi, this is Vaughn and Jen with Spirit of Health, and today we have some special guests here that we'd like to introduce you to. We're really excited about having Debbie Perry and Cheryl Gilman here with us. They're two amazing women that have been an integral part of just helping us even navigate the process of childbirth, and they've just been really good friends of ours, and they come with a wealth of knowledge. So this morning we wanted to introduce you to them and pick their brains a little bit and just kind of get some insights into the midwifery practice and share that information with you, whether you already are all on board with natural childbirth or you're weighing your options. I hope this brings some light and some understanding to what midwifery is all about.
Yeah, and we've had two amazing home births, soon to be a third, and it's just been an amazing experience, and these women have been a huge part of that. So we're excited to pick their brains a little bit and get some good information onto the importance of home birth. So.
All right. So the first question we have is, what led you to choose midwifery as a profession, and what do you love most about it?
Me to go first?
Go first.
Well, I think anybody you meet who becomes a midwife would say they had a calling at some point in their life. Mine started as a young child. I had two pretty significant events occur. The first was when I was 5.5. I went with my father to see my youngest sister who'd been born. We went to the hospital, and he takes us down a long hall and takes us to a clear window and points to a row of babies and tries to show me who my little sister was. And at 5.5, I was scared and concerned that my sister was amongst all these babies, and we couldn't even tell which one was really her. And the second thing was we weren't allowed to see my mom while I was there. Wow. So she did have a natural childbirth in the 70s, but back then they were still separating moms and babies, and obviously weren't allowed to have visitors and that kind of thing. And then the second event was just my cat had kittens on my lap when I was 8. So that really impacted me, her trusting me to take care of her as she did what she needed to do. And then just, I think my own birth experiences. I had my first 3 with an OB in the hospital. Fairly low intervention, but still interventions occurred that I didn't feel comfortable with. And then by my 4th pregnancy, I switched to a group of midwives that ran a freestanding birth center. And the difference was, incredible.
Awesome.
So.
And what do you love most about it?
I love getting to meet the families. The families, the babies, and then just seeing the change that occurs in both the mom and the dad as they walk the path and become parents.
Amen.
Yep.
Cool. Debbie?
So, back in the dark ages, my first exposure to pregnancy of anything was my mom talking to a lady over the fence saying, "She's PG." And so pregnancy was never discussed, birth was never discussed. I really never knew anything about it, but I always had a fascination. And so at 9 years old, I felt like God wanted me to be a missionary nurse, but I didn't really have a clear definition of what that was. So here I am, missionary nurse. Not really. I had a home birth with my second child because in the 70s, like she said, I wasn't going to do that the second time. So I found an old granny that delivered me at home. I did. And I'm not sure she wore gloves, and I delivered on fresh newspaper. For real. But I think the Lord was doing something in my heart, because it really solidified, do I really believe birth is normal? And I think for me, I found that trap door where I can do all things through Christ, who is my strength, not who makes me strong. But I think that it changed my entire walk with the Lord, walking through birth and having to lean so heavily on Him, that it changed my theology, it changed my attitude toward birth. And of course I wanted to be a midwife, but the little midwife said, "Oh honey, don't do that, you'll never make any money. Be a nurse." So I thought, okay, so be a nurse. So I went to nursing school, and because I wouldn't participate in abortions, I couldn't work labor and delivery, but I got stuck in ICU for 7 years, which was the Lord, because that made me understand body systems and think on my feet and deal with crises. And so that was good, but my heart was always birth. So worked labor and delivery, and that when I got to home birth, I knew that was what it was. To allow birth, so that was back in the 80s when I became a midwife and trained as a midwife. I'm getting into the second question, I think. But it is a normal body function. And to just, you see the Lord in it. You can see the Lord in birth. And you can see his hand on people. And know that people are coming up out of the wilderness leaning on their beloved. And to be able to participate in that, like Cheryl said, to see the change in the woman is what it's a ministry. It's not just a job, it's a ministry. Yeah. And you know that from what you do. To see the transformation in people's lives and to see them leaning on the Lord, that's addictive. It's addictive. It is. It's like, and then that's to awesome. Train up women to help other women do the same thing. It's just like it just grows. Yeah. And you know that because of what you do. Awesome. So did I answer your question?
Yes.
Good.
You want to ask the second question?
Yeah, tell us a little bit about what it takes to become a licensed midwife and
certified.
Certified, and how the process evolves. Just to kind of give us a little inside look at the profession of midwifery and what goes behind the education and knowledge that you have to go through to become a certified midwife.
Well, I think first, just people need to realize that there are two different kinds of certified midwives. There's the certified nurse midwife and the certified professional midwife. Certified nurse midwife gets a nursing degree and then gets a graduate degree in midwifery. So that's just a regular BSN or RN. And
advanced practice nurse.
Yes, and then into the midwifery. What Debbie and I both did was something called the certified professional midwife. And I did a 3-year apprenticeship. About 2.5 to 3 years is what it took me. And so that was a lot of self-study, over 1,200 clinical hours of documenting prenatals, postpartums, newborn exams, many hours of labor, sitting, and birth. So there's phases to that, but it can take anywhere from 2 to 3 to some women take 5 years. And then, do you want to talk about the changes that are coming with that apprenticeship model?
I came in from a different way. Even though I was a nurse and trained under certified nurse midwives, there was no certification when I became a midwife. And so now that there is the North American Registry of Midwives, that's who we're credentialed under. And so we have continuing education that we have to do. I think I spent over $2,000 last year in continuing education. It is a pretty steep process. We're both preceptors for North American Registry of Midwives. And it's not the simplest little process to become a midwife. In 2020, there is a new thing on the horizon where you will have to go to a 3-year school, academic school, that will have clinicals interspersed in it. But until 2020, there is still, we want to maintain the apprenticeship model because Cheryl apprenticed with me. And I can tell you that it's much stronger on the experience side as opposed to the academic side. Because as in nursing, you find the academic side is really strong, but then when you get on the floor with them, can they work? No offense, but sometimes you would have people with a master's degree and they could write a fantastic care plan, but could they really do the work? Did they know how to care for people? And so midwifery is really, we want to maintain the thing that it is about caring for women and caring for, early newborn. We want to keep that strong. So certified professional midwife under the North American Registry of Midwives is what Cheryl and I are. The benefit of that is that the certified nurse midwife must have a collaborative practice agreement with the physician. And so the physician has a huge influence on the ability of that midwife to practice. Her guidelines are set by the physician. There's no autonomy. And so most certified nurse midwives work in facilities, hospitals and birth centers. And I've worked in a birth center, and I can tell you that I didn't get to practice there were times that I didn't get to practice according to what I felt like was best for mom and baby. But I had to follow strict guidelines because of malpractice insurance dictated what our protocols were. And so if you didn't progress this fast, well, then you're out falling off the curve and you have to go get Pitocin and go to a hospital. There's just all these other things. And so I feel I when I come back to home birth and follow according to what my heart is, and Cheryl can say the same thing. And we practice just a little bit differently, but similarly. And we develop what we feel is right in our heart as far as how long can a woman labor, what happens at 41 weeks, what do you do with that? But we don't have a physician telling us what to do, even though with a certified professional midwife here in this area, fortunately, we have great access to to multiple physicians, actually. And so if we have someone that moves out of our level of care, that we think needs a higher level of care, we can actually call a physician and go with them to the hospital. Even though we are not the care provider at the hospital, we can maintain that continuity of care. So with certified professional midwives, you don't lose access to the system. You actually maintain access to the system while maintaining your autonomy, which is great for y'all, for birthing parents. It's great for you because then you have the opportunity to make decisions in your care, as opposed to going to a facility where they pretty much set the guidelines for you and this is what you have to do.
So that would take me into the next question, because anybody who's never done this before, they're considering it. Obviously there's this perception that you give birth in a hospital. That's just the way it's been recently. Obviously not throughout human history, but recently you give birth in a hospital. Right. So the main question so many parents are going to ask if they're new to this is a home birth safe? So what would you say to that?
For the large population, it is safe for healthy women, healthy babies. The term low risk would be something that we would look at. Does the woman fit into that category? We didn't talk about this in the credentialing, but part of doing out of hospital birth, we do have to keep up with things like CPR and neonatal resuscitation. So we are trained in dealing with emergency situations that would occur at home. And I think both of our experience would say that we have been pretty successful in using those skills and avoiding a transport to the hospital during labor. But as Debbie mentioned, we do have great access to OB physicians, maternal fetal medicine specialists here in Kansas City, that if in the interpartum period we need a consult or we feel like a mom needs higher level of care, we're able to access that care. The studies show worldwide, and also through the study that was done through the North American Registry of Midwives in 2013, I believe, that home birth is safe for low-risk women, and especially when you have someone who has certified professional midwife, out-of-hospital experience, keeps up with their NRP and CPR. The continuing ed obviously is a big piece of that. The other thing that I like to mention is part of the relationship that we build with parents is a big piece in keeping them safe.
Right.
We are able to do a lot more in our prenatal visits. We allow an hour. Obviously, we don't use all that time, but that gives time for questions and concerns, whether it's diet related, stress related, is the mom just something simple like not sleeping well, that we can give counseling and recommendation. Because obviously you don't want to go into a home birth if you're not healthy and you're not feeling comfortable with that.
And what are the rates of cesareans? Because I think I've seen that in home births, it's like less than 3%. In hospitals, we know it can range from 30 to 50 to 60.
Right.
I mean,
Yeah.
so.
Right. Yes. The transfer rate to hospital, we've talked a lot about that, it seems like. My transfer rate last year, I think I had 3 moms out of 60 last year that had to go to hospital.
Yeah.
So there's your statistics that had to go to hospital. Out of them, 1 had a cesarean.
Wow.
So, and that was a bad year for me. So we do have to keep statistics.
Right. Yes,
I
we
would
do.
say 1 cesarean in 10 years is all I've had for a first-time mom.
Praise
That's
God.
amazing.
That's amazing.
So that's the difference. Even though we work with, we're not work with, but we are the hospital that we prefer to transfer to. Can I say the name? Anyway, our transfer here, the hospital that we like to transfer to here in Kansas City has the lowest cesarean rate of all of Hospital Corp of America in the United States.
Wow.
So they
And the
work
lowest in Kansas City, obviously.
right, and the lowest in
So
Kansas
who is
City.
it? I think we should know.
Research Medical Center.
Awesome. That's good.
fantastic.
That's good.
And so they are. I called yesterday, or Monday, to have a patient go up there for a non-stress test, and they said, "Oh, it's a Debbie Perry patient." And they said, "Okay." I mean, so that's the kind of
The relationship.
relationship. And to the people that are not in Kansas City, I would really encourage you to begin to build bridges. We've worked really hard now for 13 years building, the midwives in Kansas City have worked really hard to build bridges. So there is give and take. We had another incident this week where we had to say, okay, so what do you feel comfortable with, physician? What do you feel comfortable with? What would you suggest we do? Whether we do it or not is still the client's decision.
Right.
One thing I did want to bring up about, maybe jumping back, but I wanted to go back and say, what does it look like when you go to a midwife versus a physician?
Absolutely.
Our visits, we do basically the exact same thing. We do height. We do weight, check your urine, fundal height, how's the baby moving. I mean, there's this whole list of things that we do that really you can do in 10 minutes. That's the reason why your visit with a physician for prenatal care is usually they schedule 15 minutes. 10 to 15 minutes is all your schedule, because every 10 to 15 minutes, when I was working at birth center, every 20 minutes I had to walk into another room. So really, with charting and everything involved in that, I maybe had 10 minutes to spend with the person as opposed to 45 full minutes of sitting down with the person. That's the big difference. We're building that scaffolding of trust.
Yeah.
And that's huge, because how many people, I know I delivered with a physician, you did too. It's not slamming physicians. But the truth is that's the way things are set up in their practice. It's about volume. And for us, we really, I had that. I didn't want that with my home birth, with midwifery care. I wanted to have that time where I had a relationship with my midwife, and that's what we like to do. That's fun for us. It's not fun for me to be rushing from room to room to room.
That's stressful.
Yeah.
It's stressful, and you feel like, oh my gosh, what did I forget? So unfortunately, physicians don't have, as far as time-wise, and even some, honestly, midwives that practice in the medical environment, don't have the ability to really get to know and really build a relationship with a person. If you're going to walk through the most difficult thing that you've walked through, you want to be surrounded by people that know you, that know your history, that understand your personality and what you like and what you don't like, and are also very skilled.
And deeply care about.
And deeply care about your outcome. You've got the same. We've got the same goals.
Yes.
We want this baby. We want you to go into labor, and slide a baby out and nurse a baby. That's our goal.
Yep.
That's our goal. And so that's what we're all working toward doing.
Yeah.
That's the goal. We have a joint goal.
Amen.
Whereas, unfortunately, I've been there before. Unfortunately, when you're in that other situation, you really are having to think liability. You're thinking liability because malpractice is very expensive. And it does dictate, unfortunately, it does. I mean, I've had to write protocols for birth center, for home, and for hospital, because working in hospital, it does affect it.
Yeah.
So statistically, back to what you said, I believe 90% of the population will give birth just fine.
Right.
They don't need anybody, anything, they'll give birth just fine.
Yeah.
There is that, midwifery is recognized, I know I'm talking too much, but midwifery is recognizing,
Enjoy listening.
midwifery is that recognizing that 10% and keeping them back on the railroad track,
Right.
getting them back on normal, and then there is that 3 to 5% that will need medical or surgical help. And I think that your statistics probably say the same thing.
Yes, I think I've had one primary C-section in 5 years.
Wow. That's awesome.
Yeah.
It's so good to hear that.
That is amazing.
Cesarean is not, when cesareans happen, you want to know that it happened because it needed to happen.
Right.
We're not saying cesareans should never happen. They save babies'
Right.
lives and they save moms'
Absolutely.
lives. But you want to know that it wasn't done because somebody needed to make a tea time,
Right.
Yeah.
Yeah.
Or you weren't induced because I'm going to be off call for the weekend. You want to know that your body was given the opportunity to go into labor and give birth.
Amen.
I just love what Debbie just shared with us about how the relationship is so important in the midwifery model, and that is such the priority of creating this experience of trust. And from the mom's perspective, from my experience and doing this now almost 3 times, I feel like that is probably the most important component that I felt during both of my labors, was that I was around people who loved me, and I was around people who cared for me and genuinely wanted the best for me and my baby. And that peace of mind brought me to a place of complete trust and relaxation in the process. And I've never personally experienced a hospital birth, but I can only imagine, seeing different faces of nurses based on whatever, shift change, and whether or not your doctor's on call or not on call, and just the dynamics of my personality being in that situation. I would honestly feel a little more anxiety and less comfort. And so I really believe in home birth as a place to be. If, like they said, if you fit the 90% of the most women fall into that healthy category. I really do feel that it's the best possible way to expedite a healthy labor and a healthy delivery.
Amen.
Birth is about surrender. It's not about power to the woman. And it's about surrender. And so you want to create an environment where you feel like I am safe and I can let go. Now, what we didn't talk, Cheryl alluded to it a little bit. The first thing we do when we walk in your house is we set up a resuscitation station for baby, and we set up an OOPS for hemorrhage, because there are 2 things that you don't know when they're going to happen. I mean, it can happen and you don't know it. So that is a part of safety too, is
Being prepared.
the technical side of it, and listening to heart tones and all of those things. And we both love water birth, and so water birth creates that kind of, you're in your own little environment with you and your husband. We say we like to be back at the back end. We don't want to be in your face. We want to be listening to heart tones. We want this to be about building the relationship. We're going to walk away. Mom and dad are going to be there, and baby are going to be there. We want to do everything we can do to strengthen that relationship.
Yeah.
It's not about us. If you don't remember our name in 10 years, we're fine with that. But we want you to remember.
But we will.
Well, you have to, because I'm documenting it. But we want you to remember the look on Vaughn's face, and I want you to remember the look on Jen's face when that baby comes out. That's the goal. It's about a bond. The Lord sent those hormones in birth.
Yeah.
We want to utilize everything He's given us for life and godliness.
Amen.
Okay. We want to utilize everything.
Beautiful.
Right?
Well said.
Well, and that's the other piece that I love when you ask what do we love about it, the attachment and the bonding that occurs when you don't interfere. I mean, it's funny people will ask commonly, "What's your favorite birth?" And honestly, my favorites are the ones where I don't really have to do much at all, other than just ensure that everything is normal, and then that baby comes to your chest and it doesn't leave for days and weeks. And that to me is one of the most beautiful pieces.
It is. It is. And the science that's coming in now on brain science, the most current, the neuroscience that is coming in is backing all of this up. In fact, it's just like, it is driving us to become more hands-off unless we're needed, and to keep this as a bonding experience. The study of brain science and the amygdala and the limbic system and all of that, the more research we do, the more it confirms that we're on the right track here.
It's almost like you could say God had a plan from the beginning.
You think? Like, here's the deal. The creator of the universe, our Savior, who walked the model life for us. We can look at his life and see how he did it. Okay? Who created us and all of our hormones and all those crazy hormones as well as the good ones. The one who created all that created birth.
Yeah.
This was his idea. This is not something that happened in the fall. Okay? Birth was birth. Now, he did say, I will increase your etsev, your work, just like he said that to man. Adam and Eve were given the same word. There's another tape on this where I taught on this. But Adam and Eve were given the same word, etsev, etsev. It's a Hebrew word, and it means sweat of your brow, your hard-earned goods, and in anxiety. So there's God. That's what we got in the garden when we ate of the tree of the knowledge of good and evil. But we have a Redeemer. And I can do all things through Christ, who is my strength. He's my strength. I want you to come up out of the wilderness because birth is difficult. It is the struggle to surrender. It's the Garden of Gethsemane.
Yeah.
And come up out of that wilderness leaning on him, not, oh, I could have never done this without an epidural. Excuse me? Yes, you could. Yes, you could. Have we taken
twice?
I know, but have we taken people in for epidurals? Yes. But has it been maybe 1 out of 100? For me, yeah, maybe 1 out of 100 or less. Probably less. But when they're needed, they're there. You don't want to overuse intervention because then you create that cascade effect of complications, don't you think? Yeah. And like she said, the best ones are when you don't do anything. High five.
High five.
For that one.
High five. Can we all do high five?
High five.
This is awesome. Okay. Well, here, can we have the... And do you have something else to say?
No.
Of course she does.
I know.
But I keep talking over her. Sorry, it's like flipping a switch. I just keep talking.
Oh, no, it's
Well,
great.
we could sit here and talk for hours and hours. But I just want to say it's just an honor and a blessing to have you in our lives, to have you in the lives of other women and men, couples in Kansas City. You're making a huge impact. Never forget that. I think when we do what we do, we know we're making an impact, but it's good to hear it. But you're making a huge impact in the lives of thousands of people. And you're giving babies a better chance at a good life that they might not have otherwise had. We know the realities of what's happening out there. And a lot of it's not good.
Yeah.
Right.
And so women and men of God who can rise up and be brave enough and strong enough to go back to the ancient roots, the ancient past, to bring God back into the forefront. The original plan, it's happening in lives in different areas of influence. And it's just an honor to have you guys, with us as part of our lives and in Kansas City and the impact that you're making. So thank you.
Thank you.
It's a
Thank
blessing.
you.
Thank you very much.
Thank you.
Awesome.
Okay. Amen and amen.
Amen.